Welcome to the Foresight Health Roundup podcast, Foresight Health's podcast series for healthcare revolutionaries. Outcomes matter, customers count, and value rules. Hello again, everyone. This is Dave Burda, news editor at Foresight Health. It is Thursday, April 10th. Having fun yet? I hope you don't get accidentally snatched off the street by ICE and sent to a prison in El Salvador without being read your rights or any due process of law, because, if you do, you're sure as hell not coming back. At least not according to our own Justice Department and the U.S. Supreme Court. Good luck. You know, if we had a soundtrack for this episode, I'd cue up A Life During Wartime by the Talking Heads. Anyway, I'd never been in a prison in El Salvador, but I have been to a lot of hospital emergency rooms over the years for various reasons. I think the two have a lot in common, unfortunately. We're going to talk about emergency care in the U.S. thanks to a new report from the RAND Corporation, and there's your long-awaited transition. To share their takeaways from the new report are Dave Johnson, founder and CEO of Foresight Health, and Julie Murchinson, partner at Transformation Capital. Hi, Dave. Hi, Julie. How you two doing this morning? Dave?
Well, I'm doing great. I'm in Aspen for the Kane Brothers Life Sciences Conference, and I don't think there's any better place in springtime, the mountains in springtime. And I'm going fly fishing this afternoon. Life is good.
Yeah, sounds good.
I'm doing great. I'm in actually Laguna for the week for Health Evolution, and they had Mehmet Oz kick it off yesterday. It's quite the show.
Did Medicare Advantage come up?
Yes, it has come up throughout the hallways in multiple instances.
Are you more or less confident in the ability of the administration to address our healthcare system's issues?
I find myself more Maha, gotta tell you. But there's only so much real estate he can influence. So it's great talk track. It's just a lot, it's a lot different when you try to figure out what levers to pull.
Yeah. Kind of like his show, right?
Yeah.
There you go. All right. Before we talk about this new report on emergency care, let's talk about your last visit to the ER. Dave, I don't need specifics, but how long was your wait time the last time you were in the emergency room?
Well, it was a long time ago, and I was worried I had a concussion, but I wasn't a high triage patient. And I walked into the ER at Advocate, which is near our house, Advocate Masonic. I waited around for about 3 hours and concluded they were never going to get to me, and just went home and hoped when I fell asleep I was going to wake up the next morning, which I did. So.
Oh, rolling the dice there, Dave. Good job. Julie, how about you? The last time you were in the ER for yourself or someone else, how long did you have to wait?
Well, I think as you both know, I was in the ER recently, unfortunately, but for, I think, good reason, and all is well, of course. That was the quickest thing ever because it was 11:30 at night. And it was, a 2.5 hour N10, which does not feel like a bad experience. But I have been to the ER with my mother a couple different times, and it's been a, 6 to 8 hour adventure just to get into a room. So it's highly variable.
Yeah, that's like my experience. The last time I was in for myself, it was about 6 hours, which wasn't too bad. But by the time I left, the wait time was up to 9 hours. And like you, Dave, when people heard 9 hours, they were walking out the door the other direction. So, okay, let's talk about this new report from RAND on the sustainability of emergency care in the U.S. It's getting a lot of attention in the healthcare trade press. Let me share some of the key findings and recommendations from the report, and then get your reaction. The report identified 4 specific challenges facing hospital emergency departments. The number of ED visits are at pre-pandemic levels and rising. 2, the medical complexity of emergency patients is rising. 3, the medical acuity of emergency patients is rising. And 4, increases in demand and insufficient capacity are leading to overcrowding, longer wait times, and more violence directed toward ED staff. The report made 7 specific recommendations to address the challenges. I won't read all of them, but most of them boiled down to more money for EDs and more money for emergency physicians. For example, more federal money for the Emergency Medical Treatment and Labor Act, more state, city, and municipal funding for emergency care, especially for substance abuse disorders and mental health conditions. Higher reimbursement for ED care to cover uncompensated care costs, and more money for emergency physicians by requiring insurers, not patients, to collect deductibles and copays from their enrollees who need emergency care. Dave, did we learn anything new from this report that we couldn't get from an episode of The Pit? And from a policy perspective, how can we improve emergency care in the U.S. without throwing more money at the problem?
No, we didn't. We didn't learn anything. And as you know, I am a fan of The Pit. I can't wait for the final episode of the season. What is it in trials where the defense accepts the diagnosis or the facts of the prosecution, but then tries to shift the argument? Anyway, I accept the diagnosis. We have a piecemeal approach to healthcare in this country that's fragmented. The ED has become a catch-all for many of the U.S. healthcare system's failures related to coverage and access. I give them all of that, although if you go to the University of Chicago, ED, as I was just told recently, it is right out of an episode of The Pit that people are there for days to address their conditions. So I'm going to go a little big picture. There used to be this show on MTV called Pimp My Ride. Either of you remember that?
You're going back a ways, yeah.
Right. And basically what you would do is you would take a jalopy and then put all kinds of customized features on it, new paint job, sound system, so on. And you would end up with this car that looked great on the outside, but underneath was still a jalopy. And I think when I look at the recommendations here, we've got a version of Pimp My Ride here. We've got a jalopy of a health system. And the idea that we just throw more money at ED will solve anything is crazy. It's at best a Band-Aid, and it's a very expensive way to try to improve the overall health of the country. So the idea when you have systemic failure is to take on a systemic solution. And so without, getting too much into the details, I would thank them for their work, even though it's self-interested. You did mention that those that paid for the study would benefit from the new investment. Nothing new there in U.S. healthcare. So, pointing out the obvious flaws in the system, but then suggesting a piecemeal incremental approach as a way to address systemic failure just is not going to work. So I wouldn't spend a whole lot of time reading this above and beyond what we've done at this point. Compliment them for their diagnosis, wish them well, and don't do what they say.
Yep. I think you have the right treatment plan, Dave. That's great. Thank you. Julie, any questions for Dave?
So, Dave, I share your disappointment here. But if you're right that ED challenges are part of a larger systemic failure, then what's the right way to think about addressing change in here?
I happen to be in Aspen, and the Aspen Institute is where Walter Isaacson was president for a long time, one of the great historians, biographers in the country right now. And his first book was called Wise Men, and it was about 6 men who helped remake the post-war world. And I'm going to read a passage from a letter that George Kennan wrote to the Secretary of State at the time, Dean Acheson, about what to do after the catastrophic failure of MacArthur's attempt to win the Korean War by hopping up the coast that ultimately brought China into the war and created a